We don't have anybody signed up for public comment this morning, so we're going to start off with a coronavirus update from our Health and Human Services Director, Ryan Matthews.
Hi, good morning. Yeah, Ryan Matthews, Interim Administrator for Health and Human Services. I wanted to share our COVID-19 information as of today at 8 a.m. Marion County has 1,984 total cases, 1,901 positive tests, and 21,693 negative tests. I did want to reference the difference between the total cases and the number of positive tests, just so people know kind of how those are defined. Total cases includes the number of positive tests plus the number of presumptive cases, and the presumptive case is defined as someone with COVID-like symptoms that can be linked directly to a confirmed positive test. And that gap will kind of change as those presumptive cases get tested. They either become a positive test and move into that category, or if they happen to test negative, they would drop off of our count. So that's why there's a slight difference between the total number of cases we report and the total number of positive tests. I also wanted to mention that we've been tracking information week by week. So the positivity rate based on the testing that we conducted for the week of July 6th through 12th was 8.3%. That is down from the previous week, which was at 9.9%. It's also worth noting that the week of July 6th through 12th, we had a 68% increase in our testing capacity. So that was great to see. We had over 2,800 tests conducted for that week. Our epidemiological team has identified several cases that are linked to 4th of July celebrations, so we're starting to see those come through. And I think it's an important reminder that despite being in social gatherings of friends and family and people it's still really important to practice physical distancing, wear your mask where appropriate, and certainly have hand sanitizer and ways for people to wash their hands and maintain their personal hygiene. In addition to those numbers, we also have 98 people currently working within our COVID response in Marion County under the Health and Human Services COVID-19 response team. That includes 41 people in our surveillance group. The surveillance group is responsible for the case investigation and for the contact tracing. And I really want to acknowledge the work of that team. They work 7 days a week, constant shifts, and they're really responsible for responding to cases as we receive them within 24 hours. That's one of the measures that Oregon Health Authority tracks for individual counties. For the last week, for example, we were at 99.1% that we had achieved that metric. The goal for the statewide is at 95%. That means out of the 226 cases that they had identified, they had followed up within 24 hours on 224 of them. So I think that's pretty amazing work when you have cases that can come in at really all hours of the day and night. So I really appreciate the dedication of that team. And despite having 98 people as part of this response, we're continuing to grow. We're adding resources to maintain to be able to help support and assist schools with their reopening plans. That's part of the responsibility of the local public health authority. So we will continue to see kind of the numbers of people participating in this COVID response grow from our department, and I really want to acknowledge and thank them for all their hard work and dedication to really trying to keep our community healthy and safe, which is one of our top priorities in our department. And I think I think that was really all I had to share there. Were there any specific questions or anything?
Please. Oh,
if I could. Ryan, I know you probably haven't announced it, so I hope I'm not breaking anything, but 9 hospitalized today. We were talking before the meeting. Typically, we're seeing 1, 2. I think I saw 4 yesterday. Right. When does that get significant? And I've misspoke once, or maybe lots of times, on the hospital beds available. Mm-hmm. Would you repeat that number for me?
Oh, geez. I don't have the exact number of hospital beds available. I know it's quite significant, and we've never hit a threshold that's really put that at any kind of risk of jeopardy. We would be...
I think I used 500. Is that just...
That seems
that's Salem Health. That's the total beds in Salem Health under ordinary conditions, under their emergency.
So then there's San Am and Silverton on top of that.
Yeah, mm-hmm. and there's a limited number beyond that of like ICU beds and things. Okay. So it depends on the severity. But we do have a team that is monitoring hospital capacity on a regular basis, and we've not reached a threshold that's a significant area of concern there. The 9 hospitalizations that we're reporting today, that is a concern. I don't have any. We just got this report, so I don't have any data on any of the specifics or what triggered that. I think that it's an unusual amount for us, even when we looked as of yesterday sort of at a prolonged trend. We were seeing a downtrend in overall hospitalizations, and I think we were taking that certainly as a positive sign that despite having some increases in the number of cases, we hadn't really seen an increase in hospitalizations until recently. And so I think now we have to determine, what the source is of that.
It
if there are
sure
any
looks like an
trends.
echo from the holiday. It times out about right, doesn't it? And I hope tomorrow.
I mean, it certainly
isn't
has
worse.
been, in terms of the cases we've been researching and identifying, there's been a link to those 4th of July celebrations, so I don't know that I can make the link to the hospitalizations. We'll have to do more research, and I'll have to get back to you on that. But I agree, today's number, that is certainly concerning and something worth investigating.
Thank you.
And I just want to make a note, we talked about it yesterday, but we know about some of the links to family gatherings of 4th of July because we've been able to ask that question. As we've all seen, there have been mass protests and other large gatherings. We don't know if that has had a link because that hasn't been a question that OHA has wanted asked in the investigation. So I think it's important that we know that the information we know is because we're asking that question, and information we don't know is because we're not asking that question because of OHA's position on that.
Yeah,
So,
and we're also certainly dependent on what people are willing to share. So, when we ask the questions on where people have been, it's up to the integrity of the individual that we're talking to also to be forthcoming and share or remember all the different places that they've been to help us, make those connections as well.
yeah, thank you. Commissioner, you had something on that?
No, I'm good.
I just got one other comment. I don't know what happened, but I didn't feel good when I got home. So you start thinking, oh, here we go. But then I was also thinking about how many people I could have been close to in the last week or so. That contact tracing could be a huge number each time.
Yeah. It certainly gets more challenging, and as people have resumed somewhat more of a new normal, people going to work, people frequenting restaurants and other businesses, it just means that your potential for points of contact has only increased, certainly. And I think that our team, does a diligent job in tracking that down. It's also really, I think, one of the things that Governor Brown mentioned in her press conference recently was how important it is for people to return the calls of those contact tracers and to, be willing to respond to those questions. I think that sometimes there's some difficulty in reaching, people and having people willing to share and speak with our contact tracers and provide information. It's really helpful for us to be able to fight the disease and to be able to inform people that may be at risk of spreading the disease elsewhere. So I think that was a good reminder for people as well. Our team is here to support them. We're here to get them resources. We're here to make sure that they're healthy and safe. And so that's our priority.
Hey, Ryan, I do have a question. You said we have 41 people in our surveillance group right now.
Mm-hmm.
Are we planning on increasing that? Or are we done with our hiring? Where are we in the process?
No, it's sort of around-the-clock hiring. We kind of do it in waves, in part because, there's only so many you can onboard and train, realistically with the infrastructure. But we've just made a request for an additional 20 contact tracers that we have sent through the recruitment paperwork for, so we should be seeing a job posting soon on that. So We're kind of in a constant cycle of we do a recruitment, we train and onboard, and then we turn around and continue to hire because we know we're here for the long haul. We need enough depth and capacity of staffing to be able to meet the need, and so it's going to be something we're going to be doing ongoing.
Okay, thank you. Oh, you did.
Yeah, I do. This is not related to COVID, Ryan. Your lanyard, I'm trying to read.
Some you don't want to know.
What?
You may not be familiar with this. It's a Rose Bowl, and it's Oregon Ducks.
But I see a W on there.
Well,
Am I a Badger? I'm proud of that, or what?
Well, Wisconsin also made it to the Rose Bowl. They weren't as successful as we were, but they made it on the lanyard.
Okay.
We're going to try to stay relevant here, Commissioner.
I was squinting. I looked because I saw the orange on there, and I'm going, does that say like? Are you trying to be like bipartisan and wear something that has like ducks and beavers and? Okay.
No. When it comes to college football, I cannot be bipartisan, so can't do it.
Some things it's best to ignore.
Don't ask the question you don't know the answer to. It's right. Yeah.
A lesson for us all, yes.
All right. Thank you, Ryan.
Thank you.
Appreciate it.